So I just got a pop-up that said the recording was in progress.
Yes, so did I.
Okay, so
Someone needs to make Katie the host. So Rachel, will you make Katie the host?
and let's see if it keeps recording. Katie has to be the host so that she can share her screen.
Whoever's sharing their screen, you don't have to be the host to share your screen. You can just share it.
It's
There's a note that pops up that says that the host has disabled participant screen sharing.
right.
Okay, so it's easier if the host just enables that button for this one meeting. That way, Katie, without having to be the co-host, can just share her screen.
That would be great. Thank you.
Raquel is the host right now.
Okay. Where do I go?
Okay, so just click allow participants to share screen. Click that.
This one?
Okay, so now you should be able to do it. Just test it once to see if you can share your screen, Katie.
Yes, it works now. Thank you so much.
Okay, so you're good to go.
All right, thank you, Leslie.
You're welcome.
All right, everyone, I think we're ready to go. It is 12:02. And if I can, it is 12:02. My name is Raquel Hammond. I am the current presiding officer of Mid-Pearland Toastmasters Club. If I can please have you join me in reciting the Pledge of Allegiance.
Mm-hmm.
I pledge allegiance
Allegiance to the flag of the United States
and to the
of
republic
America,
for which it
and
stands,
to the republic
one
for which
nation,
it stands, one
under
nation,
God,
under
indivisible,
God,
with
indivisible, with liberty and justice for all.
Thank you. At this time, I would like to remind you all to please mute your phones or put them on vibrate and mute your speaker as well, your monitor as well, your computer. And I would like to introduce the guest that we have with us this morning. And we'll go ahead and start here in the boardroom with Ms. Sheila. If you can please introduce yourself.
Hi, I'm Sheila from the Elvin Sun and Advertiser newspaper. However, I focus primarily on the Meridiana and Sterling Lakes Lifestyle magazine. And if you're interested in advertising, give me a holler.
Thank you, Sheila. And now we'll go to our guests that are joining us through Zoom. Victoria, if we can start with you.
Good morning, Victoria Rawls with MD Anderson Cancer Center, and I am in Community Relations and Education.
And Miss Katie.
Hi, good afternoon. My name is Katie Ostman, and I am also with the University of Texas MD Anderson Cancer Center. I'm on the Be Well Communities team, and I'm so glad to be here today. Thank you.
Thank you very much for joining us. And at this time, I would like to introduce our executive committee. If I can start with Miss Margaret.
Hello, everyone. My name is Margaret Harrison. I'm the Vice President of Education for Mid-Pearland Toastmasters. So what I do, I help our new members with their first couple of speeches and help everyone navigate our educational system called Pathways. Thank you.
Thank you, Margaret.
Kim. Good afternoon, everyone. My name is Kim Morrow, and I am the treasurer for the Mid-Pearland Toastmasters Club. As the treasurer, I collect the dues for new and renewing members. Thank you.
Thank you, Kim. Karen. Oh, I'm sorry, Karen, we cannot hear you.
No. Always.
Okay, while Karen works on the technical difficulties, we'll move over to Mr. Stute. Gus?
Hello, our president, Raquel. My name is Gus Dude. I'm your vice president of membership. My role is to help potential new members and even previous members to join our wonderful club. That's my role as your VP of membership.
Thank you, Gus. The Toastmasters International mission is to empower individuals to become more effective communicators and leaders. The Toastmasters International values are respect, integrity, service, and excellence. Tony, will you please read our club mission statement?
Sure. We provide a supportive and positive learning experience in which members are empowered to develop communication and leadership skills, resulting in greater self-confidence and personal growth.
Thank you, Tony. The main duty of a Toastmaster is to act as a host and conduct the day's program, including introducing the participants. The Toastmaster creates an atmosphere of excitement and expectation. Please help me welcome our Toastmaster of the day, Ms. Kim Morrow.
Good afternoon, everyone. As your Toastmaster, I'm responsible for giving a joke of the day or a toast. So I found a toast that I think is pertinent to today's topic. The toast is, may we live to learn well and learn to live well. So let's raise our cups and bottles to learning to live well.
Toast.
Here. At this time, I'll introduce our functionaries, and the first person is our grammarian serving today, Miss Karen Jackson.
Can you hear me now?
Yes.
Awesome sauce. Look at me being a technologist over here. Okay, so as a grammarian, it is my role to make note of grammatical errors, but mostly to look for exciting and new usages of vocabulary during our meeting. Thank you. Oh, I forgot the word of the day. So the word of the day today is aplomb.
Aplomb.
Meaning self-confidence. He handled the speech with such aplomb that we thought he had given it many times. Aplomb, self-confidence. Let it show. All right, thank you. Back to you, Madam Toastmaster.
Thank you, Karen. At this time, I would like to introduce our timekeeper, Mr. Anthony Whitley, please.
Good afternoon, I'm Anthony Whitley and I'm the timekeeper today. And one of the lessons to be practiced in speech training is that of expressing a thought within a specific time. As the timer, I'll be responsible for keeping track of the time of each segment and participant in the meeting. I will signal the participant with a green screen when they have reached the minimum qualifying time. Midpoint will be yellow and a red will signal 30 seconds remaining. And after that, it'll be time out. That is all. Back to you, Mrs. Toastmaster.
Thank you so much, Anthony. At this time, I would ask that our table topics master, Miss Margaret Harrison, tell us about the table topics master, please.
Hello, everyone. So Table Topics is our opportunity to speak on the fly. We must use the word of the day, aplomb. Within our table topics, we have 1 to 2 minutes to do so, and you may embellish. So go ahead and do some tall tales for us, but use aplomb. Thank you.
Thank you, Margaret. And last but not least, I'd like to introduce our general evaluator, a very important role, Holden Rominger.
Well, thank you. Today I will be your general evaluator. The purpose of the general evaluator is to evaluate everything that takes place throughout the meeting. During the meeting, I will take notes on everything that happens and does not happen. I will evaluate each participant on the meeting program and look for good examples of preparation, organization, delivery, enthusiasm, observation, and performance of duties. At the end of the meeting, I will give my report. Thank you, Madam Toastmaster.
Thank you so much, Holden. At this time, I would like to tell you a little bit about our guest speaker. Our guest speaker today is Katie Ostman, and she is a program manager with the Cancer Prevention and Control Platform at the University of Texas MD Anderson Cancer Center. She has 9 years of experience in health education, community health assessment, public health programming and implementation, and managing partner relations. Katie is a Master Certified Health Education Specialist, certified via the National Commission on Health Education Credentialing. She earned her undergraduate degree from California Polytechnic State University in kinesiology and completed her Master of Public Health at Kansas State University. Today, she is here to teach us how to spot skin cancer. Please join me in welcoming Katie Ostman to the virtual lectern.
Thank you so much for that introduction, Kim. I really appreciate it. And at this time, I will start sharing my slides so that we can commence with the presentation, unless there is anything else that needs to happen prior to that. Well, thank you again for inviting me to join the group today. I really appreciate the invitation and opportunity to get to speak with everyone. And also that it's able to be over Zoom, so I am able to be there. And it's just great to connect with people during these times of social distancing. Before we really get into the presentation, I wanted to mention that even though I'm not at MD Anderson today, I'm giving the presentation out of my home. If I were at MD Anderson and I were in an area that needed to be, I would be wearing a mask and following all social distancing guidelines. However, I am in my home, and so I am not wearing a mask at this time. And I would like to encourage everyone to ask questions as you would like to during the presentation. You can either use the raise your hand feature and Victoria can assist me with that, or put a note in the chat. Or if you'd like to come off mute, if you have a really burning question, I'd be happy to accommodate questions. And if you don't have a question, it would be great if you could stay off of mute, or on mute while I'm doing the presentation to reduce background noise. And like I said, Victoria will be assisting me in seeing if there's any messages in the chat or any questions that pop up so that I can answer them in real time.
And real quick, I see that the chat is disabled. It says chat disabled. So if you do have a question, a reaction button or a hand up, or you can write it down and Miss Katie can answer it at the end.
Thank you for bringing that up, Victoria. I appreciate it. And so as Victoria demonstrated, the presentation will be interactive, and so she demonstrated using the little button. If you feel led to participate in that way, we definitely encourage that. So I would be remiss if I didn't talk a little bit about COVID-19 and what you can do to stop the spread. So we do encourage everyone to maintain social distancing as is appropriate, to wash your hands for 20 seconds or more with running water and soap, to wear a mask as it's deemed appropriate by the CDC, to get tested again as you feel it's appropriate and as you need to, and to consider getting vaccinated. And I will note that we do offer vaccination at MD Anderson, and so if you are interested in that, Victoria and I can provide more information at the conclusion of the presentation. So today, the primary topic that I'll be covering is skin cancer. And so we'll be discussing a general overview of what skin cancer is, cancer in general and skin cancer, how you can reduce your own personal risk for skin cancer, and some screening exams and early detection that are available for skin cancer prevention and treatment. So we'll start off with a common understanding of what cancer is. Cancer is not a single disease. It's a group of more than 100 diseases that can occur when there's uncontrolled growth of abnormal cells. When these abnormal cells build up to the point that they become an abnormal tissue mass, it's called a tumor. Now, not all tumors are cancer. 9 tumors occur frequently and they're not cancer. They can usually be removed and they don't spread to other parts of the body. Malignant tumors are cancerous and may in fact spread or metastasize to other parts of the body. Cancers are named according to the part of the body that they originate in. For example, if breast cancer metastasizes or moves to the lungs, it's still called breast cancer. It's not called lung cancer at that point. That's because the tumor in the lungs is made up of breast cancer cells. As you can see in the picture, the top row are nice normal cells that are all in a line, and the bottom picture is a picture of cancer cells or an abnormal tissue mass.
Real quick,
So
Kim,
now, yes.
are you able to hold the microphone a little bit closer to your mouth so we can hear a little bit better?
Yes, I can also do my best to speak up a little bit more. Is
Yes,
that better?
perfect. Yes, much better. Thank you.
Great. Thank you for bringing that up early in the presentation. So if you feel comfortable now, you can click the thumbs up button if you think that there is more than one kind of skin cancer. And if you don't think there is, then no reaction. Thank you for participating. Okay, so the answer is true. There are many types of skin cancer. There are many types of non-melanoma skin cancer. The 2 most common types are basal cell and squamous cell cancer or carcinoma. Basal cell cancer accounts for over 90% of all skin cancers in the United States. It's a very slow growing cancer and it seldom spreads to other parts of the body. Squamous cell cancer spreads faster than basal cell cancer, but may still be relatively slow growing. It can spread or metastasize to other locations, including internal organs. Another type of cancer that occurs in the skin is melanoma, and you may be most familiar with this kind. And it begins in the cells that produce pigment of the skin. Melanoma usually begins in a mole, and it's less common than basal or squamous cell carcinoma, but it is far more dangerous. Melanoma usually appears as irregular brown, black, or red spots or a changing mole. So which of these spots do you think is the most dangerous? Does anyone have any guesses? If not, it's fine.
Melanoma.
Yep, couple guesses there. Melanoma, number 3. And I will say it's really hard to tell, and this is why skin exams are so important. So we're going to go over each of these now. So the first one is actinic keratosis. It's a precancerous skin growth that's usually caused by sun exposure. The term precancerous is used because these abnormal areas of skin are more likely to develop into cancer than healthy skin. Precancerous growths, often called lesions, are visible to the naked eye, and they look different from normal cells when they're examined under a microscope. This type of cancer usually occurs in individuals with fair skin, especially elderly, and in young individuals with light complexions. It often appears as rough red, brown, or scaly patches on the skin, and often people can feel it before they can see it. I would like to point out that this photo is just an example, and so it's not intended to treat or diagnose anything. And so if you do have a concern about something that may look similar on your own body, please do make an appointment with your dermatologist for screening. The next spot we'll look at, and my apologies if anyone has a little bit of a squeamish stomach, these pictures, especially when they're large, can be a little bit gross. So this slide shows examples of basal cell cancer, and they grow by extending to surrounding areas and destroying normal tissue. If left untreated, they often ulcerate, bleed, or crust over, and they can metastasize to bone or other tissue. After treatment, often it comes back to the same location as well. As many as 50% of patients with basal cell cancer will develop a new cancer within 5 years of the first diagnosis. Basal cell cancer usually appears as small pink bumps or patches, as you can see on the slide, and it occurs on the head or neck. Sometimes it may be found in other parts of the body, though. And again, I want to point out that this photo is just an example. It's not intended to diagnose anything. So the next photo I have here is of squamous cell cancer. And this cancer can be more aggressive than basal cell carcinoma, and it's also more likely to grow deeply below the skin and spread to distant parts of the body. Often it looks like basal cell carcinomas, but it's usually more scaly and rough. It's often found on the head and neck, but it does have a tendency to grow on the ears, lips, backs of arms, and hands. Squamous cell cancer can also develop in other skin areas like scars or ulcers. And it's often is developed on sun-exposed skin of older individuals. Again, this is an example not intended to diagnose. And now we'll move on to melanoma. Oops. So the risk of melanoma increases with age, but it does frequently affect young and otherwise healthy people. Although it's less common than the other types of skin cancer that we covered, the rate of melanoma is steadily increasing. It's the leading cause of death from skin disease. Unusual moles, exposure to sunlight, and health history can affect the risk of developing melanoma. And there are multiple types of melanoma, which I won't go into today, but just know that there is more than one kind. And there just one kind is highlighted here on the slide today. So again, if you feel that you have a spot that you think may look something like this photo is not intended to diagnose anything, please do speak with your healthcare professional. So again, some reactions. And if everyone in the big room wants to give a thumbs up or down, and the ones on Zoom can click the thumbs up button if you think that wearing sunscreen is the only protection that you need when you're outdoors. Those of you who gave a thumbs down, perfect. Yes, the answer is false. In addition to sunscreen, there are several other things that we can do to protect your skin from sun exposure. Skin cancer, for the most part overall, is caused by too much exposure to the sun. Some tips that you can use to protect yourself include protective clothing. If you must be outside in the sun, it's important to cover up with clothing, sunscreen, and sunglasses. It's important to apply sunscreen about 30 minutes prior to going out in the sun so it has a chance to be absorbed by the skin, and to reapply thereafter every 2 hours. Or even more if you're perspiring quite a bit or swimming. A sunscreen that has a SPF of at least 30 is a good choice for most people. SPF stands for sun protection factor. So the way that I like to remember it is 30 minutes before going outside, put on SPF of 30 or more. And if you're spending a lot of time indoors near a window, you still need sunscreen. A lot of times the glass is not of, it doesn't have the protection that you think it might in order to protect your skin from the sun. So I am sitting next to a window, and if I were going to be sitting here all day, I would certainly put sunscreen on at least this side. If you're in the United States, the sun's ultraviolet rays are strongest between 10 a.m. and 4 p.m. A good time to stay indoors if you can. And we all know that here in Houston, it's a great time to stay indoors since it's so hot, even if it's not that sunny. And babies should never be exposed to direct sunlight. It's important to shield them with protective clothing when you're out during the day. And sunscreen should not be applied to infants under 6 months of age. And it's important for you to be a role model and teach your children to apply sunscreen before they go out and play. And I will note that it's important to not substitute indoor tanning salons for roasting on the beach. Tanning beds produce the same radiation as the sun. No tan is a safe tan. A tan is a sign of skin damage. And I will note that with COVID-19, many of us are spending more time outdoors to cope with the emotional impact of social distancing, and the stay-at-home orders have had a lasting effect on people. And it's a great time to get in the habit of applying sunscreen before going outside. Our experts also urge you to wear sunscreen, as I stated, indoors, especially if you're spending lots of hours in a sunny spot. Window glass doesn't, in fact, filter out the UVA radiation. So I will say it's very important, as I mentioned just a moment ago, to protect your children from the sun. It's important to, as I said, to cover babies completely, especially those under the age of 6 months who can't wear sunscreen quite yet. For babies over 6 months, it is very important to apply sunscreen, again, SPF 30 or higher, every 2 hours and 30 minutes prior to sun exposure. And it's important to teach older children how to apply themselves in case you're not always right there with them. One major risk factor for developing skin cancer later in life is having blistering sunburns as a child. So it is very important to do what you can as a caregiver to protect children from the sun so that they don't get those blistering sunburns and increase their risk for skin cancer later in life. All right, some reaction time. So you can click the thumbs up button or give me a thumbs up on your video if you think it's safe to use sunscreen on a daily basis. Thank you for all the thumbs up, and you are right. It is true. All sunscreens are safe to use on a daily basis. There is no evidence that exists that daily use of sunscreen is unsafe. And I thank you for participating. So how much sunscreen do you need is a very common question that we get. 1 ounce of sunscreen is about how much you need to cover, properly cover the exposed areas of the body. And you may be asking yourself, how much is 1 ounce, especially when you have a 16-ounce bottle and you're just not sure, did I use 1/16 of this? So an easy way to think of it is the amount of sunscreen that would either fill up a shot glass or is the size of a golf ball. And sunscreens are lotions, creams, oils, or other products made up of special chemicals or agents that, when applied to the skin, absorb or reflect the sun's harmful rays to minimize skin damage. Sunscreens protect your skin from the harmful rays called ultraviolet or UV rays. The sun releases 2 types of harmful rays that reach the Earth's surface. So we have ultraviolet B or UVB rays and ultraviolet A rays or UVA. SPF does not increase proportionately with the designated SPF number. So for example, SPF 15 absorbs 93% of the sun's burning rays, while SPF 30 absorbs 97%. The SPF number on sunscreen only reflects the product's screening abilities for UVB rays. So it's not additive if you put on SPF, let's say 15 on your face, and then 2 hours later you put on SPF 30, you don't have SPF 45 on your face. You still have just SPF 30. And that's a common misconception. And it is easy to not quite understand everything related to SPF. It is complicated. But just know that MD Anderson does recommend an SPF of 30 or higher regardless of the type. And all sunscreens are safe to use on a daily basis. I want to go back to one of the speaker notes that I have on this slide. Sometimes it's, I said earlier, and it's easy to gloss over that sunscreen only reflects the product's ability to screen for UVB rays. And so the sunscreen is only protecting you from one type of ray. The UVA rays are just constant throughout the year, and they are what they are, and sunscreen can't unfortunately help with that. That is why we do recommend the other preventive measures such as clothing to stay inside between 10 and 4, etc., since sunscreen can only do so much to protect you from the sun. And if anyone has any further questions, please do let us know specifically about that. So we just talked about some ways that you can help protect yourself from the skin, or from the sun, protect your skin from the sun. And it's also important to be aware of changes in your skin and keep track of new and changing spots. You know your body better than anybody else. And it's important to have awareness of different and changing spots. This will help you and your doctor detect skin cancer early when it is the most treatable. The things that you can do include looking for new spots or spots that change, watching for sores that don't heal or heal and then come back, being aware of spots or sores that change in sensation or are itchy, tender, or painful. And it's also important to check everywhere because skin cancer can develop in places that don't actually get skin exposure. This includes the soles of your feet, your buttocks, and genital area. So it's important to not be bashful with yourself and check everywhere. You can also get help to inspect these hard to see areas such as the scalp, especially for women who have a real defined part in their hair. It's important to check it and make sure that everything looks normal and that there aren't new spots or things that change. So it's important to have help when you need it. It's important to pay attention to rough or raised areas when you shampoo or apply lotion. That's an easy thing that you're already doing. And so doing a little skin check while you're in the shower or applying lotion can be a great way to combine rich flintstone there. And lastly, pay attention to changes in your moles. Related to COVID-19, I just wanted to reiterate that you shouldn't let COVID-19 prevent you from making an appointment right away for any of the symptoms or warning signs that do persist. If you feel like there's a problem, please do make an appointment with your healthcare provider. When you're doing skin checks, it's important to look for the ABCs. And I will add an F on the end when we're done with this slide. So when you're looking at your moles, it's important to check for asymmetry. Does half of the mole look different from the other half? B is for border. Is the border of the mole irregular or ill-defined? C is for color. Is the color uneven? For example, are there shades of one or more colors, or has it changed over time? D is for diameter. Is the mole larger than 6 millimeters in diameter? And 6 millimeters is about the size of a pencil eraser. E is for evolution. Is the lesion growing in width or in height? And then what I like to add at the end is an F, and that's for feel. And as we discussed in some of the earlier slides related to the different types of cancer, sometimes you can feel things before you can see them. So it's important to feel your skin and see if anything feels different. And I will say that a positive finding of any of the ABCs may indicate that a mole is malignant. And so it's important if you see any of these signs to remain calm and call your healthcare provider and they can help out. The key to treating melanoma is recognizing symptoms early. You might not notice a small spot of concern if you don't look carefully. So it is important to look carefully and be thorough in your skin self-examinations. Getting examined for skin cancer is only recommended for individuals at increased risk. And so people who are at increased risk include those who have red hair and freckling, albinism, and more than 50 moles, a family history of melanoma, or any genetic syndromes associated with increased sun sensitivity. Other individuals at risk are those who have environmental exposures, such as excessive UV light exposure, tanning equipment use, or history of blistering sunburns, as we discussed in childhood. Others at increased risk include personal skin pre-cancer or cancer history, including basal and squamous cell carcinoma, actinic keratosis, or dysplasmic nevi, and those are moles. And lastly, individuals at increased risk include those who have had prior radiation therapy, immunosuppressive therapy, or other therapies that may increase risk. And so that's not an incredibly or totally comprehensive list of all those who are at increased risk. So it is important to discuss with your healthcare provider the right timing for you related to getting screening for skin cancer. And it is important to keep an open dialogue with your healthcare provider related to any suspicious skin areas, any sores that don't heal, or any changes in moles or freckles. So we've discussed many things that you can do to help reduce your risks of cancer or detect it as early as possible when it's more easily treated. And MD Anderson is here to help you. We do provide the entire spectrum of cancer care from prevention to survivorship. If you think you may have cancer or you have been diagnosed with cancer, it's important to get the right diagnosis from the beginning. MD Anderson often corrects misdiagnoses and prevents patients from undergoing unnecessary procedures and treatments. That's why it's important to start at MD Anderson if you or your doctor suspect that you have cancer. MD Anderson does offer cancer screening, and we do have locations that are outside of the medical center if it's more convenient for you to not go to the medical center. And MD Anderson is very excited to offer additional virtual cancer prevention presentations. Today, obviously, we just focused on reducing your risk for skin cancer, but there are several other topics that we have subject matter experts that we can send out either virtually or hopefully in the future in person. And these are free programs, as you know from the presentation today. And we're always happy to set that up, and Victoria and I can answer any questions related to that. As well, if you are interested in another skin cancer another prevention presentation, you can go to mdanderson.org/community, and that site is also listed there on the slide. If you have general questions about MD Anderson, this is our general phone number for any inquiries. It's the Ask MD Anderson line. It's 877-632-6789. Or you can also go to mdanderson.org/prevention, and we have lots of resources available on there. If you'd like to learn more or see any more in writing related to the information and topics that I presented today related to skin safety. They also have lots of other prevention topics on there. And so at this time, I will take down my slides and I will be happy to answer any questions that you may have.
Thank you so much, Katie. That was so informative. I believe we have questions. I think I saw some hands. Margaret and Anthony.
Margaret, you first.
Okay, thank you. So Katie, one of the slides you mentioned there were some factors that you should pay attention to and maybe even get a screening for. And I think I heard you said like if you have 50 or more moles. Alrighty, so I remember I turned 25 and moles started popping up everywhere. I even got one on my eye, on my eyelid. So, and I think it's more than 50. But I noticed my mother also has tons of moles. Could it be hereditary?
It is possible that it can be hereditary, and that's a great topic of discussion to bring up with your healthcare provider to discuss if the presence of the moles does put you at increased risk. And if it does, then they can make a plan of action for you to determine what you need to do in terms of screening. But it is important to really be on top of your moles and understand what they look like, where they are, do a mole map with your healthcare provider, those types of things. And at a lot of the prevention appointments that MD Anderson does have, we do a full skin mole mapping. And so that's something that one of the first things that they do here if you do come to MD Anderson for screening. And it is important to, even if you're not at increased risk, to understand where your moles are for any other healthcare needs that you may have that they present.
Thank you.
Anthony?
Yeah, I have a question about spray-on sunscreen. Is it just as effective as the lotion?
This is a very common question, and I'm really glad that you asked about that. So sometimes, especially with kids, it's very easy to give them a spray and then let them go and run into the ocean or whatever they're doing. But it is important to look at that reapplication period. And so while you can still have an SPF of whatever factor you're applying, let's say it's 30 or 45, it is important to make sure to reapply often, especially with the sprays, because sometimes you might miss an area, or especially with kids that are running around and it's kind of hard to sit still to get an even coating. So we do recommend that you really examine the reapplication window when you're using a spray sunscreen. And there are different, I will say, different active ingredients in different sunscreens. And experts at MD Anderson have indicated that some of the most effective sunscreens have the active ingredient of titanium dioxide or zinc. And so often if you go to a health fair and you get a little tube of MD Anderson sunscreen, it will have those active ingredients in it. We do like to give sunscreen that has those ingredients.
I have a question too.
Oh, go ahead. You first. Go ahead, Tony.
Okay. I just wanted to see about or ask about the pre-screening at MD Anderson. Is that something that your insurance would pay for? And if you want to get a screening, do you just contact MD Anderson directly, or do you have to go through your physician?
No, you can self-refer to MD Anderson. And so we have a cancer prevention center. And so you can call ahead and make sure that your insurance is taken, and then they can set up the appointment from there, especially if you have concern if your insurance will or won't be taken. They can work with you before they go through and do the whole appointment. But you can definitely self-refer to MD Anderson. And like I said, if you don't want to come into the medical center, a lot of times it is very daunting, then you can definitely make an appointment for the exact same screening at any of our Houston area locations.
Thank you. I had, I guess, a clarification question. Can you tell us a little bit more about what is the difference between UV and UVB rays?
Yes, definitely. I'm going to flip to my notes so I can make sure that I'm getting it all correct. So I'm going to take just 1 second and make sure I can find that slide.
I think these are the best questions we've ever had with this presentation. Love it.
Hooray, Toastmasters.
Said no.
Hmm?
Said no table.
No, if we do table topics, I think we may have time for maybe one or two questions. It's the only thing we'll be timing.
So UVA rays, sorry, I appreciate the extra minute to look that up. So UVA rays are present throughout the entire year. And so it's different based on where you are in the US, but they remain constant throughout the whole year, winter, spring, summer. So that's UVA. UVB rays are caused by differences in the sun's intensity. So UVB changes with the time of day and the time of year. And sunscreen is effective against UVB rays. So again, that time of year. So it's important that during other times of the year when maybe it's not as hot, if you are going to be spending extended time outside, it is important to cover up, again, your arms, legs, wear a hat, and make sure to wear the sunglasses as well. Thank you for the question. These are really great questions.
And we have one more question from Karen.
Yeah.
You're on mute? Okay.
Just quickly, as I was going through listening to your presentation, of course, I was somewhat of a hypochondriac. I began to feel things on my skin. And I have this question. Initially, I had 2 lesions on my neck area, and I assumed that they could be ant bites or, I've been outside gardening. So now that you mention it, I'm like, okay, should I get this checked out? Or what would be a determining factor between a bite and a lesion?
So my best answer for that would be a lesion that does not heal.
Yeah.
So if it is not healing, I would have it checked out. And if you are nervous about something, please do check with your healthcare provider. And we do encourage people to get checked early and often.
Thank you. Thank you.
Ms. Autry? You're on mute, Ms. Autry.
Ms. Autry, could
Ms.
you
Autry.
unmute yourself?
Okay, I was just explaining that the hand is too far over and kind of a beigey color. It's difficult to see. But when you talked about older persons who were exposed to the sun a lot when they were young, I thought about all those days we walked from elementary school, and it took about 30 minutes. And of course, school let out in the hottest part of the day when the sun is really intense. We walked everywhere during those times. Well, not after elementary school. We had transportation. We rode after elementary school. But the things we participated in, we were in the sun a lot. So one of the things you mentioned was a person who was exposed to the sun a lot when they were young could, as a result of that, after all these years, have something that's a result of that overexposure to sun. So tell me about that, please.
Yes, that is correct. So when children have sunburn, I'm hearing a little bit of an echo. Is anybody else?
Yeah. Just everybody's on mute, maybe.
I'll try again. So definitely when children have sunburns, and even if, let's say after, for example, age 10 or something, they have great skin protection and they don't have any more sunburns, they still are at increased risk for developing melanoma later in life if they've had intense sun exposure earlier in life. And so it's definitely a consideration to discuss with your healthcare provider and or dermatologist related to if your sun exposure earlier in life has put you at increased risk. And it's important to, that question is not typically on a health screening questionnaire. So now that you know, you can definitely bring that up with your healthcare provider and let them know that you feel you may be at increased risk, since they may not be asking about that.
Thank you.
Do we have time for one more question, Kim?
Yes, go ahead, please.
Okay, sorry. So this is something, a conversation that I have with my adult children often. So my adult children are Hispanic and they have a darker skin. And my son went to camp. He's 20 years old, but he went to camp to be a counselor at a church camp this week. And I was trying to emphasize how much important it is for him to put sunscreen on. And he said, "Mom, I don't burn, I'll be fine." And that is a myth, right? We all burn. We all, no matter what skin type you have.
That is correct. That is a very, very common misconception. And I am very glad you brought that up because individuals of all different shades of skin are susceptible to developing melanoma and other types of skin cancer. And so it is very important, just because you don't get a blistering burn or a burn, that you're not still increasing your risk for skin cancer. It still can, the tan is the presence of increased skin damage. And so it is, you are right, it is very important to continue to apply sunscreen regardless of the shade of your skin.
Excellent. Katie, I'd like to thank you again for excellent presentation. So informative, and we can't thank you enough. At this time, we will ask our table topics master, Margaret, to give us one table topic, and we'll have a volunteer, 1 to 2 minutes, and then we'll go into our general evaluation.
Okay, thank you. And at this time, Katie, if you need to hop off, you're more than welcome to. Thank you again for presenting to us today. Thank you.
Thank you again so much for the opportunity. I really appreciate it. And if we can answer any questions and follow up, if anything else percolates, please do email Victoria and myself, and we'll be happy to answer any questions later.
Thank you.
Thank
Thank you.
Thank you,
Have a
Victoria.
great day.
Thank you all.
Okay, so for today's table topic, it's going to be related. So Katie said that it's important that we cover ourselves when we're out in the sun. Now, as a Mary Kay consultant, I found that the area that doesn't get covered the most are hands. And hands while we're driving. I notice when I'm driving, you know, you're supposed to be at 10 and 2. 10 and 2 is getting a lot of sun. So if someone could come up with an answer to this question, I would greatly appreciate it. So the answer, well, the question is, what is a clever way to protect your hands from the sun while driving? Don't forget to use the word of the day, aplomb, in your answer. And you have 1 to 2 minutes. Any volunteers? Okay, Miss Karen. Okay. Which one?
If you are a plum, then one remedy to this problem of driving and having too much sun on your hands could possibly be wear driving gloves. You could be the most stylish person on the highway. The people may just be interested. You could design a set of driving gloves to go with each outfit. It could be fabulous. It could be an entrepreneur's dream. You could create a new style of driving glove that will protect your hands from the sun and also make you a very stylish driver. So I'm thinking that one remedy, one fun and outlandish remedy, if you are a plum and you don't mind being a leader and doing something new and different, then creating those driving gloves may be just the solution you need to getting your hands out of the sun and into a pair of fabulous gloves. How about that? Thank you, Madam Table Topics Master.
Thank you, Karen. That was terrific. Thank you. And I think that's all we had time for was one. So I'll turn it back over to our table, to our Toastmasters, Kim.
Thank you. That was fantastic. And I think we should hit on that a little bit later in another meeting. At this time, I would like to call our general evaluator, Holden Rominger, to tell us about the meeting today.
Thank you, Kim. All right, so today we did start a couple minutes after 12, not too bad. We're usually starting a couple minutes right after. Everything was awesome. Obviously, we had a guest speaker today, so didn't get to go through too many speeches, and we didn't really get to evaluate too many people in terms of their grammar and or time. Ryan was also not here, so we didn't even have a timekeeper per se, but we did have someone take care of that. Is that Raquel or Anthony? Anthony. That was Anthony. Thank you, Anthony. Yeah, so it was a very good meeting in my opinion. I really enjoyed the presentation. So I guess I'll ask a few questions now, see if you guys were actually paying attention. Alrighty, so she talked about the different kinds of skin cancer. How many were there? And if you do remember the names of them, what were they?
There was 3.
There was 3, and what were they?
Basal, squamous,
Melanoma.
Melanoma, awesome. And with the melanoma, is there only one type or is there multiple types?
Multiple types.
Multiple. And what is the, hang on. Sorry. So then babies under 6 months, was it recommended to use or not to use sunscreen?
Not to use.
What did she recommend instead?
Covering.
Clothing.
Protective clothing.
Lots of protective clothing. Yep. And how much sunscreen do we need when we are applying?
A shot.
A shot.
A shot.
One shot of sunscreen. Yeah. What was the other size of measurement that she used as an example, actually?
Golf ball.
A golf ball. I thought that's like a lot of sunscreen.
Yeah.
Just to,
I think a shot is a lot of sunscreen.
right?
We're all underdoing it.
And then my last question will be, there was an acronym that she came up with, sort of. She called it the ABCDs of skin cancer, right? And checking for it. So what did A stand for?
Asymmetry.
And what about B?
Border.
C?
Color.
Color. Variation.
D?
Color. Yeah.
Diameter.
Diameter.
E? Yeah.
Evolution.
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 Or?
F.
Feel.
Feel.
Expanding or enlarging?
Yeah, expanding or enlarging, and then F was feel, yeah.
Yeah.
And F was not originally in the actual ABCD. She added that one.
Right.
But
They're so smart.
still very important. All right. So that was all the questions I had for the, let me come up with one. What was the solution to the driving with your hands on the steering wheel problem?
Designer.
Very stylish driving gloves.
Designer driving gloves. I'm assuming ones with the bling that'll reflect the sun rays, right?
Good idea.
Whatever you want.
Whatever you're feeling.
We'll go into production tomorrow.
As for the grammarian and the counter, we only had the one table topic, and honestly, Karen always does a great job of that and never using those filler words.
Yes.
All righty, and I think that sums it up for the general evaluator section. I will throw it back over to Ms. Kim Morrow.
Thank you so much, Holden. Excellent job. And at this time, I will turn it over to our president, Raquel Hammond.
Thank you, Madam Toastmaster. Just want to say how happy I am that we all attended this meeting today. It was a great meeting, great presentation. I loved how everybody was engaged, and we definitely learned some things that we didn't know before. So Victoria, thank you very much for facilitating this meeting. We really do appreciate it.
Yes, thank you for having us and let us doing it. We have more topics, so we can always come.
Wonderful. I have a couple of items that I want to cover with you all. We do have a luncheon. The Chamber of Commerce has a luncheon this Thursday. It's the State of Pearland ISD. If you would like to join us, please register for it. Thursday from 11:30 to 1. And we also have the End of an Era party on Friday, June the 18th, right here at the Chamber from 5 to 7. Please come and say goodbye to Carol, Gary, and Cheryl. We would love to have you. And with that, does anyone have any questions, concerns, comments?
We do. We also have Rotary, Pearland Rotary at 7:30 here, or hybrid. You can be a guest online or via Zoom or in person. So Pearland Rotary meets here every Thursday, 7:30. Come hang out with me.
Anybody else? No, well, it is now 12:59. And with that, ladies and gentlemen, fellow Toastmasters, guests, thank you for joining us, and we will see you next week. Have a great week.
Bye.
Good evening.
Oh, Kim, we can't hear you, Karen.
Oh.
Was Karen trying to speak?
Oh, I was just saying, really good meeting, guys.
Yeah.
Nice.
Thank you, Karen. See you soon.
Bye, Miss Audrey.